Brian Mudd Show is on News Radio 610 WIOD.
We're going to check in with Dr. Fahmi Farah from Bentley Heart, and she's the cardiologist, about the president's situation and maybe some of the lessons we all might learn from the president contracting COVID-19. Dr. Farah, good morning. How are you?
Good morning. I'm doing well. Thank you for having me on your show.
Yeah, it's great to have you back. So the first thing is, as a cardiologist, we know that anyone who is elevated weight or, other underlying conditions, that puts you at greater risk. So, when you take a look at the president's situation, obviously he is overweight and he's of a certain age. Are you encouraged by how quickly he seems to be responding to treatment?
Well, yes, I am. I'm happy to know that he's doing better, and we have very little information though in terms of his actual health. We have heard, he has been receiving a few medications that typically are used for very ill patients in the hospital. We know that his oxygen saturation had dropped, more than once. You're right. Judging by the video, he seemed to be doing better because he was able to, go out. But at the same time, judging by the types of medicines he's getting, those would indicate, coming strictly from a medical standpoint, we use those medicines for very sick patients. For instance, remdesivir. Remdesivir is reserved for patients who are acutely ill, very sick patients in the hospital, not just every hospitalized patient with COVID. I believe that we still have yet to see how it plays out. I hope the president continues to recover well, and on time, and that he gets out of the hospital soon. But I don't know that he's out of the woods just yet. I think the next 24 to 48 hours would be pretty important for his health and for us to get continuous updates.
What do you think we should take away from this entire circumstance? I mean, the first thing that came to mind for me is if the president can get it, obviously any of us can.
That is correct. I think this is a very important lesson for many of us that, the virus, this is a very contagious virus and proper precautions must be taken. While we might be getting tired and fatigued of not being able to live the normal lives and we crave trying to get back into that normal mode, however, the virus does not get tired. The virus, it has one goal and one goal only, and that is to jump from host to host to try to survive. That is how the virus survives. So we must take that into consideration. We should learn from this event, and we should continue to take the proper precautions, including wearing masks, maintaining social distance, washing hands, so all those things, as well as maintaining a good health. We should not allow the pandemic to prevent us from being healthy. We should eat healthy. We should exercise. All those healthy measures should be taken.
Have you noticed a change in the virus? There hasn't been a lot of data on mutation to this point, but we know, to your point about, viruses always trying to stay alive, so mutation's part of it. It didn't seem like early on this one was, tracking the way some viruses had in that regard. Any observations at this point versus, say, 6 months ago?
You're right. Virus does mutate, and this one has mutated as well that we know of since the beginning of the pandemic. The thing with this virus, though, so far, what we've heard is it actually got more virulent, meaning it got more infectious, it got stronger. That's we do have limited data on that. It actually became stronger as far as we know. As far as, how it's behaving, it certainly is behaving a little differently from other viruses that we've seen in the past. One example would be, typically when someone gets infected with a virus and they recover from it, they grow immunity, and that's the very essence of a viral infection, and that's the idea behind vaccination. In this virus, it is unknown still how long the immunity is lasting because we are now seeing people getting reinfected with the virus. And in many cases, unfortunately, we've seen the second round of infection to be these people are sicker. They're coming in with worse condition. They're, first time around they were in the hospital on the regular hospital bed. The second time around they're going to the ICU and needing intubation. We've seen many cases of that. So that's why we need to really pay attention and take the proper measures for this virus until a cure is there, medicine, vaccine is out. You need to follow the public health guidelines.
Dr. Fahmi Farah, cardiologist from Bentley Heart. Thank you very much for the time and the information. It's appreciated.
Thank you for having me. Appreciate it.